The Bob Silent method is without patient interaction and view. The patient can relax, and Bob is for my view only at this point. As it is my patient's first session today, I will begin a Bob score with the IAP full method, which will take me approximately 2 to 3 minutes to complete. I begin by using the prime IAP in my patient's upper right sextant, as this is where the Bob score begins. I then continue to the next sextant. As I continue to the upper left sextant, I notice that an interdental space is too large for the colours indicated on this IAP. So I change to the perio IAP to measure the interdental space. On to the lower left, I am back to using the prime IAP. When using the IAP on the lower anterior sextant, it clearly indicates the colour turquoise on the probe for each interdental space here. I input this information into Bob by holding down the turquoise button, which then infills each interdental space with turquoise. I complete my full IAP assessment on Edward's lower right sextant. I then return to the upper right sextant, where I can now begin the bleeding on interdental brushing index. I can now view what interdental aids I need to use, as the colours will match with those of the IAP probe. I begin with the prime pink interdental brush and explain a little bit about the brush to my patient. I check the size, and as no changes are necessary, all I need to input are the bleeding sites. I also use a single tufted brush in this sextant, as Edward has a large interdental space here. I continue on to the upper anterior sextant and check the colours from the IAP are a correct match with the turquoise brush. No changes are required, so I continue on to the upper left sextant. Moving on to the upper left sextant, I check and measure inflammation with the prime pink brush. However, in one area it is necessary to use the red Perio 405 brush, as this is the correct and necessary size here. Moving on to the lower left sextant, I continue with the interdental brushes and input any bleeding present. When using the turquoise on the lower anterior teeth, no change is necessary and no bleeding is present. I finish on the last sextant, that being the lower right. The Bob Silent assessment is complete and it is now time for the review and coach before the patient receives his Bob score.